Right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki here with Charlotte Mbou and Maria Manzan for this first briefing for Partners for Teach to Reach 11. We'll be starting in just over 2 minutes, as you can see. And if you're wondering what is this Teach to Reach and who are these partners, we're going to answer those questions. But it is peer learning by and for people who work for health. So if you work for health, there's a chance that this is going to be of interest to you. Now, we are about to get started. The other thing to note is you can find the Teach to Reach website and already register. You can see that Teach to Reach is, as of today, 49 days, 20 hours, 31 minutes, and 33 seconds away. We'll be getting started in a minute and 30 seconds. With us in the room are organizational leaders from Africa, Asia, Latin America, all over the world. And we're looking forward to hearing their voices as soon as we start. All right, countdown last minute for this briefing for partners. Today is the 16th of October, and we are 49 days away from Teach to Reach 11. This is a massive peer learning event for people who work for health. We'll tell you all about it in a few minutes, and you'll hear from some of the organizations and partners in particular who are joining, supporting, contributing, learning from, and benefiting from Teach to Reach. We'll spell out what the benefits are for your organization, and we'll tell you, we hope, everything that you need to know to make the decision if your organization should join, contribute, and benefit from Teach to Reach. Here we go. Right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and I'm here with Charlotte Mbou as well as Maria Manzan. Charlotte, how are you doing? How are you feeling going into this? It feels like Teach to Reach 10, the biggest ever Teach to Reach in June 2024, was yesterday. But it's now been several months, 21,398 participants for the 10th edition. What are your expectations for this 11th edition, Charlotte?
Thank you so much, Reda, and hello everyone. I'm really excited, and I know that from the time we started Teach to Reach up till Teach to Reach 10, it's been steady growth, and I'm hoping for another explosion as we begin to count down to Teach to Reach 11. And I'm so excited, Reda, because I think we are getting there. There's so many new names and new organizations I am seeing in our Zoom studio today.
Wonderful. And you know, we like the way we like to start is by listening to your voice, not to Charlotte or myself. So our first question is, and I'm going to go to Jacqueline Sfragilani. What is the biggest challenge faced by your community, and how does your organization actually help? So I'm hoping, Jacqueline, you're going to be able to answer. Would love to hear from you, asking you to unmute now. Otherwise, we'll go to Hansa Desta. Jacqueline, are you able to speak? Otherwise,
Reda, we could also turn to, I don't know if Adil Murad is able to.
Yes, definitely.
Okay, Adil, please go ahead. Do introduce yourself. Tell us who you are and what organization you are affiliated with. You can clarify if you are representing the organization or if you're here in a personal capacity. And then tell us, what is the biggest challenge faced by your community?
In fact, in a few minutes ago, I have introduced myself and my organization. If it's needed, I can do it again.
Please do. Remember, there are tens of thousands of Teach to Reach participants. Not all of them know about you yet.
Yes. I am Adil Murat Ural, the head of Foreign Affairs Department of Adana Metropolitan Municipality from Turkey. The biggest challenge we face is the high rates of refugees, I may say like that. We are like 2 million people living in our city normally, but we host like 500,000 refugees, and most of them like 430,000 from Syria, and the others from Afghanistan and Iran. We try to, pave the way for them to access our public services. And it creates a big burden, by the way, for the municipality, because we don't get extra money from the central government for the refugees, but we try to tackle the problems they face. We may say that like we are a refugee-friendly city, and as our point of view, we try to tackle with their problems, and the biggest problems we may count is like access to public health services and access to public education and employment opportunities, livelihood opportunities, I may count like that. And we try to do our best to make more easier to access to public services for these refugees. I may summarize it like that.
Thank you very much indeed. Now, let's start at the beginning. For those of you who are joining for the first time, you're wondering what is Teach to Reach. It's really ongoing learning and networking for health professionals. And there's some amazing, remarkable, special opportunities, and you'll be hearing from those who've actually experienced them, to connect across all countries and job roles, from local communities to national planners. In fact, we want to ask, I want to turn to Tafurola Mutange. I hope her connectivity will be good to go, to ask you, what is Teach to Reach in one sentence?
Hello, thank you for giving me this opportunity, Mr. Reda. Teach to Reach in one sentence is a platform for networking for health professionals.
Perfect. And Tafurola, can you introduce yourself? Because you, I believe, are the current record holder for Teach to Reach 10 questions. I believe you answered over 40 of them in the last Teach to Reach, sharing your experience. Can you tell us who you are, what you do, and what drives you to share your experience to help others learn and get better as you learn from them?
My name is Tafurola Mutange from Kenya, affiliated to Kangem facility, working there as a community health worker. What I wanted to share with my fellow colleagues from all over the world was the experience I have found in my community, challenges that I faced, and I came to learn that the challenges are similar, and we have to share ideas so that we can know how to solve them and how to get the solution for that. Again, the 5 whys I learned, and I wanted to teach my people in my community. I wanted to go deeper into the root causes so that I know what to do. I have to teach my people in my community to have knowledge, to know how to embrace a new vaccine in the community when it comes to the activities in the community with the health or public health services. Thank you.
Wonderful, thank you. And I believe this is the first round of applause that you'll be hearing today, but it is not the last. We want to give you a quick recap for those of you. If you were not there, this will be a chance to get a sense of what actually happens at Teach to Reach. And if you were there, to relive some of the compelling moments and times that we want to focus on. So here we go. First of all is this number that you've all seen and heard, 21,398. That's how many people participated in Teach to Reach 10, and that was just in June of 2024. Now, you may be wondering who attends. So most participants work in health facilities and districts. Half work for government, half are francophones. And then you can see the number at the bottom, 1 in 5 face armed conflict as part of their work for health. Now, back in June, we had a remarkable series of lightning chats with global leaders who joined Teach to Reach, including Toko Elfik Puli, Renzo Ginto, planetary health specialist, Ravati Falki from Save the Children International, Maria Nera from the World Health Organization, as well as Kate O'Brien for immunization, David Akpan from eHealth Africa. But they were not the stars of the show. You were. Health workers doing the daily work just as they do at the global level, really working together. We honored women, inspiring women at Teach to Reach 10. We focused sharing experience on climate around the health impact for local communities on the front lines of climate change. And then we also discussed for the very first time at Teach to Reach community engagement to sustain malaria action. As part of under the banner of climate change and health, we also focused on health impact on climate due in relation to neglected tropical diseases. Also at Teach to Reach 10, we introduced the health workers' experiences, tips from the front line focused on HPV vaccination. We launched the Nigeria Movement for Immunization Agenda 2030, and we celebrated EPI's 50th anniversary, 145 million lives saved through this program, through the power of immunization, showing what is humanly possible. Now, as we head into Teach to Reach 11, you'll be receiving and looking at the outputs, the knowledge that you have produced, the experiences and insights that you have shared are yours, and we are going to be giving them back to you in the coming weeks and months. So that is a quick recap. We now turn back to you. And I'm going to ask Charlotte to guide us to our next speaker. What is your organization's experience of Teach to Reach? So not just you as an individual, but really your organization, as today's briefing is focused on organizational representatives and organizational partners. Charlotte?
Thank you, Reda. I'm seeing a raised hand from Husseini Saliu, but I want to encourage all those organizational leaders that participated at Teach to Reach 10 and in previous Teach to Reaches. If you are able to raise your hand to answer that question, that would be great. And I also want to recognize those that have been responding, answering the questions in the chat. So Husseini Saliu, okay, please go ahead. And do not forget
to... good afternoon, my colleagues and the other health professional workers. I'm Husseini Saliu, calling from Nigeria. That's Kaduna State, under this country. I'm a health professional, which is I work with Solina International Research and Development. I'm experiencing a lot of challenges during our routine immunization and SIO outbreak response for immunizing under 5 children in our communities, which is especially in non-compliance and child absent. Then I work with Site Saver under neglected tropical diseases, which is eliminating, controlling the neglected tropical diseases, especially onchocerciasis, schistosomiasis, and the helminth transmission diseases. By doing this, overcoming these programs and overcoming the challenges, we have worked a lot of heavy work to sensitizing people and advocacy and sensitizations to work how to control these programs. This is a little experience which is I have in my community. I have truly helped them to overcome these challenges in my communities.
Thank you, Husseini. We appreciate you actually answered the previous question, but were you at Teach to Reach 10 on 20th of June 2024? Were you with us for Teach to Reach 10?
Yes, I was trying to participate on that training, but that time I am not able to join the training due to difficulty of the network on that time.
Okay, understood. All right. Well, thank you very much indeed. Now, this, as you know, Teach to Reach 10 was the first time we invited locally led organizations to become Teach to Reach partners. And there we saw something remarkable happen as well. So we want to honor you today as for the organizations that are returning, and also hopefully inspire those of you who are attending from the first time to consider the power of this many health leaders representing almost as many organizations who have already participated in the Teach to Reach partnerships process, 4,081. And when we break down at what level do partner organizations work, we see that 60% are coming from health facility or community level or district level. There's another additional 13% that are sub-national. Now, the amazing thing is, and I want to thank and recognize again the organizations that are attending today, 733 as of the 16th of October. We just launched a call to action for Teach to Reach 11, and already we have 733 organizational leaders who've already confirmed their participation in the Teach to Reach process. So, a quick word about how we define a local organization. So, based in a community, has a mission to serve community needs, is led by community members, and is accountable to the community that it serves. Now, one specificity of how we define local organizations is that we recognize that local partners can be private, so NGOs, civil society organizations, private sector, say pharmacist organizations, or public, such as local government services. So what happened at Teach to Reach 10 was what we saw organizations investing in Teach to Reach on an unprecedented scale. You can see the number of individuals representing organizations. More than half attended 3 or more sessions. 1/4 were Teach to Reach alumni. So this also brought many new organizational leaders. Again, you can see the breakdown here between government agencies, CSOs, other types of nonprofits. We also had many universities, advocacy groups, social enterprises joining, as you can see here. And we saw that globally, we're reaching organizations with an African focus, 77 countries represented, and of course, this bilingual approach that is indispensable if we want to actually address the needs where they are most urgent. So, next question for you is then, how has your organization applied something that you learned from Teach to Reach 10 or a previous Teach to Reach? So, Charlotte, I suggest we had heard from Hensa, from Africa CDC, so working at the regional level rather than in the community. But again, all system levels are collaborating or talking to each other. Hensa, are you able to speak to us? Asking you to unmute. Yes. All right, please.
Yes, thank you so much. Thank you so much, Rida. My name is Hensa Hadush. I work as the National Coordinator for as the Eastern Africa Regional Office for Africa CDC, which is the Africa Union specialized health agency. I am representing the technical division, and our biggest issues in Africa has been recurrent disease outbreaks, which are pandemic-prone diseases. This can be mentioned like the Mpox, currently declared as a continental concern of health security, and as the WHO also declared as a public health concern of public health emergency of international concern. Where the other one is cholera outbreak, because of the recurrent drought and El Nino. There is a frequent cholera outbreak in many member states. We are also experiencing some challenges in vaccine access to contain this cholera outbreak, especially it's happening in some of the conflict-affected areas like Sudan, Ethiopia, and some other countries like Somalia. The other disease concern in the Africa CDC is the Marburg outbreak in Rwanda and in other countries before. It was in Equatorial Guinea. Malaria, measles, polio, and other viral hemorrhagic fever and other zoonotic disease outbreaks are the main concerns of the Africa CDC. The other concern, very important concern to be addressed, we are planning to address for the next, especially for the Teach to Reach, is the vaccine hesitancy. As we are also working to create a vaccine access in Africa through the local vaccine manufacturing, there are also persistent vaccine hesitancy among the communities of different stratifiers, and vaccine hesitancy because of so many advocacies by the anti-vax hampering the.
So hence, Adesta, sorry to interrupt you, but
vaccination.
I need to ask, so what can you think of an example of something that Africa CDC, that through your participation you learned and took back to Africa CDC and were able to use? An experience that was shared, a tool or something that was presented, something that happened that actually helped you in your work at Africa CDC?
Yeah, that is the integration of the vaccines.
All right,
Yeah,
wonderful.
integration was the key lesson that we took.
Okay, well, thank you very much indeed.
Yeah.
All right. Now we're going to tell you about Teach to Reach really step by step. So first of all, the dates, 5th and 6th December 2024. All right, and you can see the different stages here. We're going to focus, we're launching Teach to Reach questions on Monday. If you already know what they are, get ready, where you have some suggestions there. If you don't know, we're going to explain it. So first of all, 3 reasons why we recommend, we advise, we suggest you partner with Teach to Reach, and it's all about developing your organization. 1, share your experience. 2, increase visibility. And 3, access opportunities. And you are the organizational leaders that we have invited, but this opportunity is open for all your staff, all your volunteers, including community members. If they are active or reach through your organization, can be invited to Teach to Reach. Now, the timeline, I've given you the date, 5th of December for the Anglophones. We're hoping to have a malaria special event during COP29, and we'll have a special announcement, which we're not going to make today. We'll give you some hints, but we won't actually, we'll hold on the official announcement, but it's something very exciting we've been looking forward to sharing for a while, and then you can see the other dates for the timeline here. If you haven't subscribed to the event calendar, this is for everything at the Geneva Learning Foundation. It's very simple. You just go, you put in, you can add it. It then shows up to your calendar and makes it very easy to see what's coming next, so you don't miss anything. The conference website is already open. Again, we haven't announced it, but because you are organizational partners, so considering becoming an organizational partner, we're really happy to share that with you. And then for those of you who suffer from poor connectivity problems, we do have the podcast in many different ways, including the Teach to Reach questions, through which you can actually participate, not just listen, but also contribute. That's extremely important. Now, we're going to tell you about the before, during, and after Teach to Reach. And again, before Teach to Reach is kicking off today for organizational partners and for everyone else, we'll be kicking off on Monday, the 21st of October. We'll ask you Teach to Reach questions. We'll also invite you to participate in special events before Teach to Reach, and we'll invite colleagues from your organization and networks. Now, so Teach to Reach questions, we send out a series of questions on specific themes that we know are of interest to the community. We ask you what those themes should be after each Teach to Reach. This time we have a concern about including everyone in Teach to Reach. So we have 3 practical suggestions. So in your organization, think about whether one or more of these might be helpful. And we're thinking of the barriers of connectivity as well as literacy. So one practical suggestion: as an organizational leader, you may be in a position to organize a watch party that can be simple as finding a laptop and gathering everyone that is interested around the table to actually watch and listen and contribute to the Teach to Reach sessions. You can go a step further with the Teach to Reach questions, because it's not just about receiving information. It is not training, it is sharing of experience. So to really read the questions aloud to those who cannot read, discuss the answers together, write down key points from the discussion, and then actually share back, submit the answers. You can specify that it's an answer from a particular group in your organization or from someone who is not able to submit themselves. And then I know that many of you in your activities have community radio sessions. So when you receive a Teach to Reach question, as a leader in your organization, we encourage you to explore if and how the Teach to Reach questions could be discussed during one of the community radio sessions, of course, where it makes sense to do so, where it fits. And then if you could share back with us what your listeners said through this kind of dialogue that complements the back and forth we can have for those of you who have access online. And again, there's a very tight deadline, I think, which is the 21st of October. Why is that a tight deadline? Because if members of your organization do not register for Teach to Reach before that date, they will miss the first set of Teach to Reach questions. So that is a very tight deadline this week. It's not to put pressure on you, but it's really to get the process kicked off as soon as we can and to be as inclusive as we can. And now, Charlotte, back to you. Our next question then is, what question would you like to ask to fellow health workers, and how would the answers? So, of course, there need to be questions asking participants to share their experience around, say, disease outbreaks or a specific disease outbreak, or around the use of malaria bed nets or the impacts of climate change on health. What questions would you like to ask, and how will the answers help your organization?
Yes, Reda, I know Justine Namuli, your hand was raised for the previous question, but I know that this question still applies to you. You could start from there and end with this one. So I'm asking you, Justine, to unmute yourself. I hope you are able to unmute. Okay. And please, do not forget to introduce yourself.
Hello, everyone. My name is Namuli Justin, and I'm from Uganda. I am CEO for Justin Health Ventures, which is a health and well-being which is an organization handling health and well-being in the grassroots communities in Uganda. I would really want to ask fellow health workers working in the grassroots communities, like if there is anyone there, like how do you do it? Like how have you been able to do community mobilization, community sensitization, and how have you promoted primary health care, like in your own context, not on the side of the government, but how have you complemented and integrated primary health care services within the health service delivery that you do as an organization? And this will help my organization learn from other organizations, see how we can better strategize and serve our community health champions better the services that we provide at the grassroots, and see how we can work together with different community health workers to provide this service to the last mile people. Thank you so much.
Understood. Thank you very much indeed, Justine. All right, we'll hear, I see several hands raised, and then, yeah, go ahead, Charlotte.
It's Naomi Chindum. Your mic is already unmuted, so please go ahead. Seem to be having connectivity issues. Rather, we are not able to hear Naomi, so Rahul Majid.
All right, Charlotte, let's keep trying.
Yes, Reda, and I thought I saw Antonio's mic was unmuted.
Yes, so we'll be introducing Antonio very soon.
So Watara Yahaya, please, over to you.
All right. Thank you so much for the insight.
Oh, I can't hear Watara, unfortunately. Let's keep trying, Charlotte. All right, I see Naomi. Did Naomi just not respond, or Raouf Majid?
Responded. Naomi is actually unmuted, but we are not able to hear her.
Okay.
Connectivity issues. Asobasi, hello, Stephen.
Yes, thank you so much. My question to healthcare workers is related to malaria vaccination. Following the introduction, we have seen low uptake for second and third dose. What are the health workers doing to increase uptake of malaria vaccine second and third dose that would really help to attain the best protection against malaria disease in those areas where they're operating? That's my question for healthcare workers. Thank you.
All right, thank you very much indeed. And we're taking note of these questions. You may find that one of your questions is selected for Teach to Reach 11. And again, we'll be starting to send out Teach to Reach questions on Monday, 21st of October. So there's really an imperative now I realize that our speaker missed the second half of the question. How will this help your organization? That's really what we're most interested in, because this is the organizational partners briefing. So you were invited in that capacity, representing or at least affiliated with a specific organization.
And Reda, I wanted to add that for those who are having issues with connectivity or getting to speak, you can also type your questions. That is in the chat. You can type your response questions in the chat.
That's a great suggestion.
Answering that question would help us to design appropriate intervention to increase uptake of the third and the fourth dose of malaria vaccine for children, for eligible children. Thank you.
All right. Thank you very much indeed. I will come back to that question. Now, this is all before Teach to Reach. What happens during Teach to Reach is you'll be invited, of course, to attend plenary sessions to share experience. We'll have the Leaders and Partners Forum specifically for leaders and partners to be heard, really, to share your successes, your lessons learned, your challenges, your needs for support. You'll, of course, participate in one-on-one networking and then join workshops with partners and experts. Now, after Teach to Reach, we'll ask you to share what you learned with your organization. So not just as an individual, but how your organization has been able to use this. And then, of course, there'll be the certification process, and we'll be using the Knowledge to Action Hub to really help apply new ideas. So that's the roundup for Teach to Reach before, during, and after. And now we go probably one of the most critical parts, especially for those of you who are new to Teach to Reach, and that is, so what? How is this going to help my organization? And just to clarify, I think I saw a couple of questions before we go there. Bubakar Jallo, who asks, are questions answered now or during Teach to Reach 11? So think of it as an ongoing, a continuous learning process. So we'll be sending out questions starting on Monday, and you'll receive them by email. And what we're asking is if you can share within your organization to make sure that as many of your staff, volunteers, and community members are registered before Monday, so that they don't miss any of the Teach to Reach questions. All right, and taking note of some great questions coming in via the chat. Now, to the benefits, and we want to try to spell out what we think are some of the benefits for organizations around global collaboration, skill development, problem solving, and community engagement. So benefit number one is that through Teach to Reach, you can share your real world knowledge. Your team's daily work makes you and your organization the experts. Because you are there every day. What Teach to Reach does is provide a way for you to share what you know with others worldwide, so everybody benefits. And also, of course, by sharing experience, every organization teaches and learns at the same time, and that is benefit number two. Now, benefit number three is that Teach to Reach brings organizations together to make bigger changes than any one group could alone. And that's really about becoming part of a global platform, network, and community. And then the fourth benefit is really about your team and your team's performance growing through active learning. And there it's worth going into the details. First, it's your staff and volunteers and community members, clients, users, beneficiaries, you may call them by different names, caregivers, really can practice sharing their ideas with people from around the world. Learn how to give helpful feedback to other health workers. Number 3, get better at explaining your work to different audiences. And then 4, developing skills in thinking about and improving the work that your organization does. So this is an active way of learning that helps your team grow professional skills that they can use every day. So these are what we see as the benefits of Teach to Reach. Of course, we'd like to know what you see as the benefits of Teach to Reach, and we are going to ask you that. But just to sum up, global collaboration, skills development, problem solving, and community engagement. And mark a pause here to see if there are any burning questions, Charlotte, before we go into how to actually become a Teach to Reach partner.
Definitely read that. There was the question from Nuch J. Geritsma about that specifically in the chat, how to become a Teach to Reach partner.
Okay, so that's next.
So that's next. And so many other questions that are in line with our previous question about what people like to know. So I think we can go forward.
All right, wonderful. So here are the 6 steps. And now if you were a partner for Teach to Reach 10, you have already completed some of these steps. The first thing I want to say is you do not need to do them again, okay, if you have done them the first time, with one exception, and that is to communicate the announcement around Teach to Reach. I'm going to lower all of the attendees' hands and just ask you if you can raise your hand if you have a question or comment or would like to share your experience, in particular on the benefits, but also the practical steps to becoming a Teach to Reach partner. So if you are already a Teach to Reach partner, as I've said, it's only steps 3 and 4. Share the Teach to Reach announcement and report on your sharing activities. But some of you did not complete steps 5 and 6, again showing you the full list here, because we did not ask you to for Teach to Reach 10. So with Teach to Reach 11, we are going one step further to ask your organization to follow through, to have your chief executive sign a letter of endorsement on your organization's letterhead. We'll share with you a template, and then you can take it from there and adapt it if you wish. But there's a few key things that need to be in the letter. And then we also ask, if appropriate, that this letter of endorsement is shared with staff and volunteers, and that will really complete the partnership process for everyone. But the sharing of the Teach to Reach announcement is really the key. There is a partnership application form, but then it's really about getting the word out for Teach to Reach, and we'll be answering a lot of the questions I'm seeing in the chat in a second. So following this briefing, everyone who was in attendance will receive the link, and it's a personalized link, so you cannot share it with others. You can share the invitation to the partnership briefing, and remember, step 1 is to attend at least one partner briefing. There will be some interesting activities, interesting discussion, dialogue, experience sharing in every partner briefing. So we saw that almost a third of Teach to Reach partners attended at least 3 of the briefings for Teach to Reach 10. So it's definitely worth attending, but if you're short on time, make sure you attend one. Second is to complete the partnership application form. Third is to share the Teach to Reach announcement, but then we ask you to take really in 3 clicks report on what you shared and how and with whom, and then that letter of endorsement process really completes the process. So the partnership application, make sure that you're actually authorized to represent and commit your organization as a partner. This is not about you as an individual. This is about you representing an organization that you're affiliated with. And of course, the organization must agree for its logo to be used for Teach to Reach. So those are some of the 2 basic conditions. I'm going to turn to Maria Manzan to ask her for her top tips, maybe your 3 top tips for prospective partners or who are going through the process for the first time. Many of you have been in touch with Maria. She's our partnerships coordinator. Very pleased to invite her to introduce herself, and also to share really her advice on how to do this in the best way possible.
Thank you, Rita. Hello, all. Greetings from Argentina. I'm Maria Monson. As Rita was saying, I'm a longtime scholar. I've participated in Teach to Reach since the first one a couple of years back, and I'm happy to be part of the team now. So as Rita was just saying, I've been in touch with some of you for your participation as a partner in Last Teach to Reach. That seems like it was yesterday, but it was a few months back. And looking forward to a very amazing next Teach to Reach 11. So going back to a partnership application, so it is very important to speak with your who's the authority that represents your organization. If it's you, better yet, there are a few steps that you will have to complete in this link that is going to be shared or that has already that you already have. And there, it's important to share the logos in a good format. I know that it allows you to upload any file, but if you share logos in Word, for example, those are some that we cannot use, or pictures of, for example, we've had people sharing selfies. Those cannot be used as logos either. So it can be a simple logo for your organization, and that will appear in our in the website of the event. And well, going back to what Rita was just explaining, that we will need a letter of endorsement that will have some details, and I can help you out with that if once you receive it, if you have any questions on it. So the idea is not to leave this for the very last minute, so we can work out if you have any trouble filling out anything there. Please don't hesitate on reaching me. I'm going to type my email in the chat so you can find me there at any time.
Thank you, Maria. I just spotted this message in the chat from Bernadette Musimenta. So I'm asking Bernadette if she'd like to unmute. I realize it can be a little bit overwhelming being in a Zoom studio with this many people, this much going on, and a lot of information. But we'd love to hear from you. And I want to really take a marker pause to take the time to warmly welcome you to the Teach to Reach family. It looks like you're not going to be able to. You should see a prompt to unmute, Bernadette. So we'd love to hear from you, but it looks like it's not going to be possible this time. So we'll go back. If there's anyone else who's new, please do raise your hand and let us know. I see Aya Yajima, so please.
Hello. Teach to Reach.
Hello.
All right. Bernadette,
Yes,
please go ahead.
Yes, I'm just grateful, really. I joined late, and I'm happy that I found at least you're still on.
Okay, all right. And can you introduce yourself? What do you do? How do you work for health? And what brought you to Teach to Reach?
Oh, yes. A colleague actually shared with me this link, I think, some time back. And I received an invitation from you people. And at the moment, Rubaga Hospital, Uganda Matters Rubaga Hospital, I'm an intern midwife. And at the moment, I'm working in the nursery with the little ones. Wonderful.
So really a warm welcome to the Teach to Reach family. What question would you like to ask? There are many midwives, many you involved in Teach to Reach. What would you like to ask colleagues from all over the world that could actually help you and help your organization? Do you have a question in mind, something that has been a challenge or a problem that you face where you'd like to get help?
Oh, at the moment, really, I don't think I have really questions, because I'm really ready to learn, and I hope to learn more as I continue interacting with you people.
Okay. All right. Wonderful. Well, we're going to do what we usually do at Teach to Reach with newcomers, which is to offer you a round of applause. And even if your colleagues look at you strangely, please do give Bernadette a round of applause. Thank you. All right, back to the partnership application. So all right, I see there's some issues here with the partnership application. So as you can see, the next step is to share the announcement for Teach to Reach. Apologies for text showing up in French. And we're actually going to propose that you do this right now. There's absolutely no need to wait. And I'm going to show you how to do it. So I'm going to post in the chat a series of links. And you should be able to see the links if you're on your phone. Look down so you can look at these. Find the links. And if you are, so we have Facebook, LinkedIn, Instagram, and X. So of course, if you're not active on social media, you can ignore this. This is not for you. But if you have colleagues on social media that you think you can reach for Teach to Reach, this is how to do it. We'll share these links again by email afterwards. But if you can do it right now, so if you click on Facebook, the Facebook link, and then you're going to go to my Facebook, and here you can see this is one of the announcements that we've shared, and you can see it's been shared by 21 people. So if you think about it, this may seem like a lot, but 21,398 participants, and only 21 of them have liked it. So people who were there for Teach to Reach 10. So if you can help make this go up, we're going to see if we can. We have 13 comments and 12 reposts. So I'm going to do again. So you first like, then you repost. You share. And then I'm going to share to my story, and then make a comment. So I've already made a comment. I'm not going to make one again. Let's see. So we have 24, 13, and 12. I'm going to reload the page. We're actually going to see instantly the effect. This is 3 clicks that we're asking you to do. That will actually help amplify the message. And of course, we'll be following up. We'll say more about communication. So 25, and you can see the other links here for LinkedIn, Instagram, and what's now known as X. So those are the steps, but then you're not done, because we'll be sharing a link for what we call the dissemination register. And this is where we ask you a few simple questions so you can tell us who you shared with. And we ask this so that we can then recognize and honor the sharing that you do. So that's what we have for the steps to become a Teach to Reach partner. But we do have one more thing. And with Charlotte, we really enjoyed putting this together, thinking through this. We appreciate Ian Steed's contribution as well. Thinking what we heard from Teach to Reach 10 is organizational leaders connecting with each other and saying, hey, I didn't know your organization was there. Maybe we could work together. And that we've already heard interesting stories. And with Charlotte, we wondered, what could we do with this potential here? Organizational leaders making connections with each other. So this is why we're pleased to introduce what we're calling Reach for Leaders. And this is, of course, we try to make it into an acronym: relate, engage, act, connect, and help. And I'd like to ask Charlotte, in your mind, we're going to develop this together with the community of organizational leaders, of organizational partners. But in your mind, what is this about?
Thank you so much, Reda. So really for us, Reach is about what I've been hearing some of you share during this session, but trying to give it a structure that is really engaging with other organizational leaders, learning from them what they are doing, sharing with them what you are doing, and using that common knowledge to advance your objectives, which is helping your communities overcome critical challenges that they are facing. So that is really it. And we want to create a platform where that exchange can take place at Teach to Reach.
So that would become the reach of Teach to Reach. So this is for leaders of community-based civil society organizations and government agencies, and really anyone who wants to share their challenges and ideas with other leaders. So are you a leader? That's for you to answer. But if you're here, if you're an organizational partner, then I would say we would certainly consider you as one. Now, what will we do? We thinking of a special meeting for organizational leaders during Teach to Reach 11, really a dedicated networking session for organizational leaders to really, have that kind of initial dialogue. What does your organization do? What does my organization do? Are there any intersections? Are there things we could be that would be worth having a follow-up meeting, introducing our organizations to each other, and then setting up a special leaders channel for Teach to Reach. So those are some of the things we have in mind. But so that is really the one more thing for this Teach to Reach 11. We do want to highlight some of the benefits for international partners. So if you are a researcher, we see the primary value probably for you is for knowledge translation. So if your researcher team has an output, or earlier on, if at the design stage you're interested in hearing from health workers from all over the world, or from a specific geography, country, or region of a country, this is something that we can help facilitate if it will make the research better and more useful to the communities that the research is about. Second would be for global health partners. It's really an opportunity to listen, learn, and engage. And then specifically for immunization partners, it's the opportunity to connect directly to hear from and engage immunization professionals who are not usually at the partners table in some, at least in some countries, as well as, we have to say, many of the national and regional leaders who do attend and participate in Teach to Reach. And then for media organizations, we had for the first time media partners at Teach to Reach 10. It's really about elevating the amazing leadership voices and stories of change. Finally, for the private sector, it's an opportunity to elevate your global health engagement with countries, health workers, and communities. So those are some of the additional sort of complementary partners we want everyone to be part of Teach to Reach, and we were planning to introduce one of our new global partners, but it looks like they're having connectivity issues, so we may not be able to do that today. The last and probably the most important part of this briefing that we want to share with you is communications, and we'll be introducing Amara Khan, who's supporting our communication effort for this Teach to Reach 11, and we're going to and she's going to be available alongside with Maria for partnerships to specifically support your organization on communication. So if you look at the steps of becoming a Teach to Reach partner, you see that there are a couple of places where you have really apologies, I'm having a little bit of an issue here. All right. So points 3 and 4, sharing the Teach to Reach announcement and reporting on what you shared and with whom. Those are communication activities. So one aspect to really highlight is the visibility for partners. So really the opportunity for your organization's logo to be on the Teach to Reach conference website that will be seen by many, many participants. The inclusion in the directory of organizational partners that we're developing, the invitation to a special Reach networking session for organizational leaders, and access to a Teach to Reach communication toolkit and templates. Now, how you go about announcing, the easiest is what we just did together, which is really to what social media communication specialists call to amplify. So to go to the existing posts and like, comment, repost, share. But we're also asking that you announce Teach to Reach through your organization's internal and public channels, amplify announcements online, and tell us how you are sharing using the dissemination register that we showed earlier, and then really to go through that letter of endorsement process. Now, one of the things that Amara and our team is preparing is really looking at the brand benefits for your organization and preparing a toolkit that you'll be able to access using what's called the Trello board. And if your organization has a communication specialist or maybe an entire communications team, we'll be sharing that with you and looking for your feedback to see how we can make this really, really useful so that you can make Teach to Reach your own, add your organization's logo, and really make the best of it. And here again, we have one more thing, which is a well-kept secret within TGLF, which is what we call the SMS team. This is a social media swarm, and it's a group who helps spread our message and activities online. And this is by invitation, but if you really distinguish yourself but through the commitment that you show and that your organization shows to actually sharing and amplifying the voices of health workers, stories from health workers, experiences that are being shared through Teach to Reach. You may find yourself invited to join the social media swarm, but it is not for everyone. Every Monday morning, the swarm receives a link to amplify, and then really they set about, it's really amazing what they've been able to do. And the way it helps them is to grow their social media skills. We'll be showing really a lot of techniques that some people don't know, and to really grow your own presence on social media. So with Teach to Reach, we really have an important story to tell, and in terms of raising awareness, in terms of expanding engagement and resources. So that's really what we have for you today. And again, we're very pleased. This is the first time that we're showing actually some of the visuals. We've shared them a little bit on social media. This is one of the cards, one of the images will be seeking to represent all geographical regions and all experiences. So we do have 8 minutes left before the end of this briefing. So I'm going to turn back to Charlotte to see if there are, what are the burning questions, and looking for raised hands. Okay, I see there are 1, 2, 3, 4. Okay, yeah, many raised hands. Perhaps we can lower all the hands and only raise your hand if you're not able to share your question or comment in the chat, or really have something where you would like to speak and be heard. Only in that case should you raise your hand. Over to you, Charlotte.
Thanks, Reda. Burning question in the Q&A from Nujay Geritsma. What is the frequency of the Teach to Reach sessions?
Yeah, so it's been contingent on many different things, but we've had 10 since January 2021. So initially the goal was quarterly. In some cases we've waited 6 and up to 9 months. But the idea is once we always take the time to work with the community to figure out what the themes are, what the questions are that the community is interested in, what will best serve you, and then we convene a Teach to Reach. In this case, we'll be making a major announcement, or actually 2 major announcements for the 2 of the major themes at Teach to Reach 11. At this stage, this is why we ask you those questions. We're still listening.
Thank you, Reda. So please go ahead and raise your hand if you have a question, or you just want to share or answer to one of the previous questions that we had asked before.
We're going to do LinkedIn. Again, this is a very practical activity. If you can actually do this right now. If you're watching online, you should be able to find the links. Just search for Teach to Reach, the hashtag, so all together. So I'm going to go to my LinkedIn and this time do the same thing. Same process. All right, here, okay, and I see now there are 23 likes, 14 comments, and 18 reposts. So it's as simple, it really is, a couple of clicks, and then adding a comment is something nice that you can do. I put in this comments. I'm not going to show this before we started the session, so I'm not going to do it again. Yeah, this is really your chance to ask a question or a concern, share a concern that you have. And also maybe we can go back to that question we had about the Teach to Reach with the time remaining. What question would you like to ask to fellow health workers, and how will the answers you may get back actually help your organization? Okay, I see one hand raised now. Husseini Salihu, please go ahead.
Yes, sir. My question, sir, is about the malaria vaccine. Despite that I'm joined the meeting late, my question is, when does this malaria vaccine was being introduced into immunizations?
All right, so during the malaria, that is a question to ask at the malaria sessions. One of the things is when learning from what is happening in different countries is actually the opportunity to hear from from colleagues in other countries when the malaria vaccine was introduced or is scheduled to be introduced. And there's value to having both individuals or people or organizations that have expertise in malaria. There's also value in hearing from colleagues who may not be malaria experts, but they have been tasked by their Ministry of Health with actually doing it. So in some cases, we find that they know things that experts do not about the practical side of things, and they are really complementary. And that is really the philosophy, the ethos of Teach to Reach, is to consider experience and expertise when combined with data to be something really powerful. And I've tried also to answer Nkeruka Nwai Zugbu's question about, is Teach to Reach only for experts in health? No, it is for anyone who is working for health. That includes caregivers, that includes community members, and so on. All right, still people saying hello. Yes. Are there other questions? Okay, I see more hands raised. Pharmacist Bernard Bediako, and then Abdullahi Abdulrahim. Please go ahead.
Hello, everyone.
We get you. We get you loud and clear. Bernard, a warm welcome to you.
Thank you very much. I'm glad to be part of this meeting. I have been with Teach to Reach, I think from inception. I was a panel member, Teach to Reach 5, and then also Teach to Reach 10. I made some cogent suggestions on that as well. So I have been a key partner of Teach to Reach. And I'm the District Director of Health Services for Amansia West District in the Ashanti region of Ghana. And Amansia West is one of the 6 deprived districts out of 43 districts in Ashanti region. One challenge that we have here has to do with illegal mining and its environmental consequences, and as well as the negative or adverse effects on health. And as the District Director of Health Services, I oversee everything health in this district. And so one major thing I do has to do with advocacy, and then also presenting the health implications of the illegal mining to the authorities, local authorities. So I do a lot of community engagement, and then also try to get support of NGOs and other organizations in terms of our advocacy and presentation of the health implications and effects of illegal mining, especially with the heavy metals that are used, mercury, and then also the inorganic ones like the cyanides and the chlorides and the lead and other ones. So it's really a huge challenge here. And with the illegal mining, when they are done, they don't cover their pits and they don't reclaim the land. And so the pits become breeding sites, especially when it's rain, for the Anopheles mosquito. So if you get the female ones breeding there, and then also they are infective, then the malaria would be spreading. So when you come to our top 10 OPD morbidities at our health facilities, malaria is always one. And of course, upper respiratory tract infections are also a challenge here. And then also diarrhea diseases. And so these are some of the challenges we are facing here as far as health is concerned.
Thank you very much indeed.
Really advocating. Yes, thank you very much.
Appreciate your contribution. For the sake of time, I've spotted at least 2 questions. Role of researchers that Teach to Reach. Yes, you can participate as an individual researcher. Now, we work with teams on whether it's at the design stage to listen and learn, if you want to consult with the community, spell out what the benefits will be for them, or if it's at a later stage, you want to share some outputs and get some feedback and engage the community, that's possible as well. For Norce Geritsma, of course, multiple people from the organization can join sessions. So if you're the global focal point, people in the field are most welcome. There may already be some of your colleagues from the field who are participating. We have a very large, as you saw that I shared the initial numbers of organizations participating. Charlotte, is there one last speaker? We are at time and we pride ourselves on, we try to respect your time. Time is the most precious resource for so many of us. Are there any final questions or comments that you'd like to highlight or actually hear from before we close?
So read that there was Sunya Semeni Ezra. That's your hands raised. Probably that'll be the last person we'll get to hear from. before we close today's session. So Ezra, are you able to unmute yourself? You should get the prompt on your screen asking you to unmute.
All right, otherwise,
okay, so
it sounds like, yep. It sounds like we're done then. All right. Well, thank you very much. Now, the response to this call for partners has been so impressive and overwhelming that we're actually renewing this. We'll do a second briefing on the 23rd. So next week at the same time, and there we'll have more time to share and to hear from you about the Teach to Reach questions. They will have been launched, so we'll be asking you, have you shared how many people in your organization will be attending Teach to Reach? How far are you with the application process? Have you secured the letter of endorsement from your organization? But we'll also be welcoming many organizations that were not able to make this briefing. Of course, we'll be sharing the recording, but that's also important to say. Once again, thank you. And I'd like to ask you, this is such an amazing community. With Charlotte, we're honored, and with Maria, we're honored to be trying to do justice to your commitment, enthusiasm, diligence, leadership, and really hoping to see more in the near future to reach further. And now we'd like to invite you, if you'd like to leave a last message, you can say thank you. I think the thank yous should be to each other for being such a wonderful community. So please, before we close, last chance to share your messages.